And welcome to Chantex Multimedia live streaming directly to your device all the way from beautiful Brisbane, and it's a beautiful day there. We will quickly look at what the day is holding, and it's once again warm welcome to everyone. And ladies and gentlemen, as we know, what we're going to do with many of our segments now is separate our daily news update segments from the regular segments that happen, like the real estate updates. Then we have the travel updates, and of course we have the migration kasafar and many other programs like that. So those programs we will have separate, but if there is a one-off interview, that will always be within our news and update segments. So most of the days the news segment will be first, and then we will go into the special feature for the day. So we will have a transition period where we transition from the old system to the new as we go, and that once again has come about by your feedback, and it is wonderful to get that feedback. Please, if there's anything that you'd like to see on the program, any improvements that we can make, please do make those suggestions through the comment box, and we will implement those changes, because the show is for you. We might be sitting here doing and thinking that we're doing a wonderful job, but that might not be what you want to see. So based upon the audience feedback, we have made that slight change whereby special or specialist presenters programs will be, or a standalone program apart from our daily news updates. That way it can be shared with people of who might have interest in those things as well. So looking at the weekend, tomorrow we will have the weekend special at 10 a.m. Then on Sunday, of course, I'd like to do a big shout out for this week's or this month's Music Junction, which will be live musicians joining us all the way from Kolkata. That's right. So Arnab and Annie joining all the way from there, and it will be hosted by Sharma, and it's going to be a very, very nice evening. I know it's Holi, so you spend the daytime celebrating your Holi. In the evening, sit down, relax with some beautiful ghazals, melodious numbers coming your way. So don't forget that this Sunday from 6 p.m. we have the Music Junction live, and truly live. We'll have live musicians and singers joining us all the way from Kolkata. We have done all the tests, and it is going to be very good. And it will be hosted by Pragya, who is a very, very popular host. So right now, moving on, let's take a very quick look at what the weekend has in store for us. With that, let's welcome Dilraj.
Good morning everyone. Weather forecast for the rest of today is maximum 30 degree. Brisbane area is mostly sunny with light winds becoming southerly 15 to 20 km per hour and then becoming light in the middle of the day. Fire danger is low to moderate. Sun protection is recommended till 10 past 3 and UV index is predicted to reach 9, that is very high. Over the weekend, minimum will be 19 and maximum will be 30. Brisbane area will be mostly sunny with light winds. Sun protection is recommended from 8:30 in the morning till 3 p.m. and UV index is predicted to reach 8, that is very high. That was the update for the weekend. Till tomorrow, stay safe and enjoy the rest of your day.
And thank you very much for that update, Dilraj. That's looking like a great, glorious weekend. And of course, we know that there's lots of functions that have been organized for the weekend, and we will look at all of those in great details later on in the show. Right now, let's take a look at what's making news and what's happening out there in the community. So, first up, we have that China is going to stop accepting special British passports. So, what's going to happen is that China is not going to look at the Hong Kong passports. So what's going to happen is China tells country to stop accepting special British passport from Hong Kong. The Hong Kong government confirms a report that it had told 14 countries to stop accepting the British travel documents from Hong Kong. As we know, in the olden days, even lots of British colonies, they all had British passports, including Fiji, or many of the British colonies, and before their independence, they all used to have the British passport. Now, the British passport issued by Hong Kong, China says do not accept that. Well, right now, moving on, the next news is the DIS at Parkes celebrates 60th birthday by helping with the first commercial mission to moon. More than 50 years ago, it helped broadcast the moon landing around the world. The DIS at Parkes will support one of the first commercial space flights back into the lunar surface. Wonderful and well done. Of course, we know Australia is very strategic placed and it always gets that good coverage there. Our drunk driver was 6 times the legal limit while unlicensed and unregistered, police say. Wow. So, a South Australian man will face court after he was allegedly caught swerving over the road in an unworthy car without his seat belt on before coming to a stop in a hotel car park, and he was drunk 6 times over the legal limit and unlicensed and unregistered. So there you go. All those things in one. Well, right now, moving on, the next news is the Border River floods droughted the farmers' first good crop in years. And after a long time, people had very good crops, but, it's all being caused, as you can see from this picture. Major flooding has resulted in a savage blow to farmers in New South Wales and Queensland border by destroying millions of dollars of crops after years of creeping drought. They say more accurate BOM information is needed. BOM means the Bureau of Meteorology. So as you can see from that photo, the widespread flooding. So we had the bushfires, come the drought, and then the floods. So, unfortunately, that's the way things go here. In a tilt to misinformation driving a surge of coronavirus cases in Papua New Guinea. Well, not only Papua New Guinea, in many other places in the world, there have been lots of news about coronaviruses, but, many times people are worried about how credible those news are and what's actually really happening with that, when you look at the coronavirus cases all around the world. Medical experts in Australia, its nearest neighbouring, are battling on not only the wave of new coronavirus inspections, but in a deluge of misinformation. All the misinformation around the coronavirus is causing a lot of problems in there as well. Well, moving on to the next news. The next news is Van Gogh painting sold, then sold again minutes later for millions less. So how did that happen? So, when you look at a sale, once sold and then sold once again. So let's take a very quick look at that news. The sale of a street scene in Montmartre was highly anticipated as it was one of the few paintings by the Dutch impressionist master still to have been in private hands. But it sold, and minutes later, it sold for millions less. We will look at that story in great detail later on. Right now, moving on, we go to the next news, which is Copper Sinclair has a ticking bomb on his hand. A great day for Copper Sinclair 12 involves dancing, throwing paper, aeroplanes, eating his favorite food, and most importantly, no seizures. He lives with a rare and catastrophic form of epilepsy called Dravet syndrome, and under those circumstances, he's doing very, very well, proud of what he can do. So there are very great concerns about the government's postponement of funding changes to Aboriginal homelands. See, the overall of funding in remote Aboriginal homelands in the Northern Territory faced delays after a service provider criticized the process that it was rushed. And of course, when we look at the ineffective and lacking of consultation, so many times many projects or funding and other things are delivered because they are done very quickly and they need to be done, is what the government sees without the lack and with the lack of consultation, and hence there are many times many problems. So when Leonie could not cope up with real life, she ended up back in hospital, a place dealing with its own crisis. Mental health advocates say more needs to be done to support people like Leonie in the community in a bid to reduce the pressure from Perth's congested public health hospitals. So, that is a growing concern, and many times people are talking about mental health, and today's day and age, it is a very, very big community concern. Well, right now, moving on to the next news, is volatile markets rebound after the final hour of European COVID-19 cases jump. Australian shares are likely to open higher after a volatile day on Wall Street as oil prices sank to the renewed COVID-19 lockdown in parts of Europe. So, it has brought about volatility in the market with the rebound in the final hours as European COVID-19 cases have jumped. So, if you think that the COVID-19 does not affect people, it does affect all the markets and everything else that is happening around. So it has a compounding effect on many of the things that are happening. Well, right now, let's take a very quick look at, remember, we have said that many times, that, when you're going out into the flooded areas, when you're going out, always take heed of the notices that have been put out by the government. And most important one of that is that if you ever come across a road that's flooded, forget it. And if you don't, this is what could happen.
Oh my God, here it goes.
The car drove off into the flooded area. I think he would cross it, but couldn't make it. Look where it ends up. And this is right here in Queensland, Springbrook.
No way. Yeah, that was good.
Took it back home.
Yeah, I'll play away. Oh no.
So, ladies and gentlemen, as I said before, the message is loud and clear, and it can't get any more graphic than that, is that look at the waters, and of course, the simple warning is, if it is flooded, forget it. Well, right now, let's join Minister Hinchcliffe, who is just behind us at Howard Street Wharf, and that pontoon that has been open, and of course, we had our Lord Mayor there earlier in the week as well. Here's that news.
You going to come in too, Sharma, or is Robert, whatever?
Yep, Minister, we're ready to roll.
Okay. All right.
We're still distance,
Yep.
yeah.
All good. Well, it's wonderful to be here by the beautiful Brisbane River at Howard Smith Wharves, and even better to be with my colleague and friend Grace, the member for McConnell, as well as a ministerial colleague, and to be with Luke from Howard Smith Wharves and Sharpie from River to Bay. A wonderful opportunity to celebrate the delivery of this first pontoon, linking and connecting Howard Smith Wharves and accessing Howard Smith Wharves from the river for the first time in almost 30 years. Seeing since the Queensland Police Water Patrol moved away from Howard Smith Wharves, this is the first time that boats have been back to access this location, to allow people to enjoy the river and enjoy the spectacular opportunities that Howard Smith Wharves represents. So it's been a wonderful partnership between the Palaszczuk government and Howard Smith Wharves and River to Bay to support these complementary projects. Some $5.5 million in support for the pontoon projects, the first of which we have the opportunity to see here today, and $1.5 million in support of River to Bay's development of their boats and the complement of their fleet in order to help people access extraordinary experiences, not only here in the Brisbane River, but out into Moreton Bay, a beautiful part of Brisbane that we don't access enough from the heart of the city. So this is a great opportunity, a great complementary set of projects that are going to deliver wonderful experiences starting from tonight. So it's really a proud opportunity for myself and Minister Grace to be able to support these businesses in the way that they're expanding their ability to cater for the visitor market, the visitor experience here in Brisbane. And it's really good timing to do that as we rebuild better after the pandemic, and we see the support coming in to see tourists come from right across not only Queensland to Brisbane, but across the country. And clearly we also need to be prepared for the re-emergence of international markets when health advice allows. We look forward to seeing international visitors come back to the heart of Brisbane and see and explore more of Brisbane, and this is a great way to support that as well. So I might just ask Minister Grace to say a few words as well, and then we'll hear from Luke and Sharpie. But so pleased to see this opportunity and experience happening. Something that when we see international visitors coming back into the local market, that the projections are that it'll facilitate some experiences for some 360,000 international visitors, and also injects almost $13 million into the Brisbane visitor economy.
Thank you, Minister Hinchliffe, and it's great to be here with Luke and Sharpie. And we announced these pontoons here a little while ago, and it's great to be here today in this beautiful part of inner Brisbane on the beautiful Brisbane River to see the first of the pontoons delivered. And there'll be passengers boarding that boat tonight, enjoying the river and enjoying everything that this great location has to offer. Howard Smith Wharves has gone from strength to strength, and it is absolutely wonderful to see now that boats are able to dock at Howard Smith Wharves, and there'll be more pontoons, more investment thanks to our boost to the tourism sector. When you come to Brisbane and people ask, what is there to do? There is so much that you can do in our beautiful city, and one of them is going to be go and get a boat down at Howard Smith Wharves and take a trip to the bay and to the islands in Moreton Bay. It's a wonderful destination, a beautiful location. I couldn't be happier as a member for McConnell that this has been delivered, and there'll be passengers on that boat tonight, and what an injection of tourism excitement right here in the heart of Brisbane. Fantastic project. Thank you, Minister, and I can't wait to hear from Sharpie and Luke about how they intend to use these great pontoons. Wonderful to be here.
Well, thanks all for coming down today. I mean, what we know is never has there been a more important time to invest in tourism. We need to create jobs, and we need to create new opportunities for when travel is open again, both domestically and internationally. We're so excited to be here today for the opening of our first pontoon, one of 3 at the wharves, and we're really thankful for the state government and their partnership in seeing the vision and unlocking the Brisbane River and the connection to Moreton Bay. Tonight we're going to welcome our first boat here, and for the first time people will be transiting from that boat and going down and having a ice cold crisp Felons lager right on the deck, right on the mighty Brisbane River.
The mighty Brisbane River, very well said, and you will remember that way down when the wharfs were being opened, we saw him, and we talked about how you can see behind such projects that all the youngsters are getting behind the projects as well. So they're doing wonderfully. And this area, this prison, as the member for McConnell, Minister Grace said that, it's one of a beautiful part of Brisbane. And when I go walking down there in the morning, sometimes I run into our local councillor as well, Councillor Vicky Howard. So it is a beautiful area, wonderful area, and with all the development that's been done and the number of people who come there, the first boat will be arriving tonight. Well, I might be there to see that. I might bring you some footage for tomorrow after that. But it is wonderful to see all the developments that are taking place there. It's wonderful that the partnership between Howard Street Wharves, the Brisbane City Council, and of course the state government. So it's a three-way deal, and of course looking at that trifecta when everyone's working together, it is wonderful to see that. And we knew that just pre-pandemic it used to be chokers, and still, if you try and get a booking in any of the restaurants there, you will be pushed to get a booking if you leave it till last minute. But crowds are nowhere near to what they were, pre-pandemic. But it is slowly rebuilding back up, and all that I'm talking about, the development, is just out this window, which I can see here. Not the ones behind me, which is looking across to the Ann Street to the Valley End. It is on the side window. So it is wonderful to see that development and all the people coming in there. Of course, the traffic gets a bit hectic getting in and out on the peak hours, but there's lots of parking. As we know, Howard Street Wharf has got lots of parking underneath. So underneath they did quite well in designing it that way that below the surface is all the parking, and upstairs is all left for people and cyclists and walkers and party goers and everyone. And it's just a beautiful and wonderful atmosphere there. So, ladies and gentlemen, before we get into the interview for today, don't forget we have Sanjeev Sharma from DJJS Sansthan, Australia, and its Brisbane branch to come in and talk to us. Let's take a very quick look, a message from our sponsors.
GlobeNet Realty. GlobeNet Realty has been the longest established, trusted and respected agency in its trade area. Washa Chandra, Director of GlobeNet Realty, provides honest and ethical service to her customers. If you are thinking of investing in Brisbane real estate market, or if you are seeking professional property management, then you should contact Usha Chandra today on landline 3865 4466 or mobile 0419 775 416. And for further updates, log on to our website www.globenetralty.com.au. GlobeNet Realty is your own local real estate agency. Situated at Shop 52281 Sandgate Road, Boondall. GlobeNet Realty. Real estate is our world.
Ladies and gentlemen, and welcome to this very, very special segment where we are going to be talking about Bharatiya Warsh, which is the Indian New Year celebration, and it is always presented by DJJS Sansthan, Australia, and the Brisbane chapter or the Brisbane branch presenters. And with that, I'd like to welcome to the studio Sanjeev. Welcome to the studio.
Thank you, Ashley. Thank you very much. Jai Hind to everyone.
And wonderful that you could be here in the studio. So we're talking about Bharatiya Warsh. Before we go into that, I'd like to know a little bit about DJJS Sansthan itself.
DJJS Sansthan is runs under the guidance of His Holiness Shri Ashutosh Maharaj, and we are a non-profit organization. It's a social, spiritual, religious organization, and we are working all over the world. We have branches everywhere, almost Europe, Australia, all Saudi, all these countries. And our vision is from self-awakening to global peace, and we are working for global peace and through the different various events, and Bharatiya Warsh is one of them.
And it is very wonderful. And in another segment, we will probably talk a little bit more and grow into details about activities of Divya Jyoti Jagriti Sansthan. And we have witnessed a lot that you have done right here in Brisbane. But today, especially, we are talking about Bharatiya Nav Varsh Utsav 2021. So, which means the Indian New Year Festival. Utsav means festival in 2021. So, when we talk about Bharatiya Nav Varsh, so how is that calculated and what is it?
First of all, Misha, I would like to ask you from how your Josh. Is it okay? so we move forward from here. As an Indian New Year is like it's a very scientific. It's come in the month of either March or April, based on Vikramaditya calendar, and is always on the first Navratri. And all our ritual festivals is not on a particular date, and it always come according to our Shukal Paksh and our calculations, our astrology and all these things based, and everything is, because I'm talking about from science here, everything is based on science.
And correctly said, because it is very scientifically, and of course a lot of mathematics is included in that. As we know, if you look at the Indian tradition, their calculation and the way of calculating things, they started ages ago. Even in scriptures, they have calculated the distance from earth to the sun in Hanuman Chalisa. So they were very good in calculation. So that is why it is calculated. It does not follow the English calendar. It follows the Vikram Samrat, as you have mentioned. So, ladies and gentlemen, that's why it is. So, Indian New Year celebration, and you have mentioned before that there are so many different celebrations in different parts of India, and you are trying to combine everything so that it's presented in one way. Could you touch a little bit on that, various aspects of Bharatiya Nav Varsh?
Bharatiya Nav Varsh, first of all, when Bharatiya Nav Varsh is just we are entering from spring to summer in India, and this is a very good time for everything. We are close to Vaisakhi and Ram Navami, so many other festivals, it's Easter, like it's a very good time. If you see all these things happening, it's very positive energies on its full height, because everywhere there's a positive environment and almost every community is celebrating something. But why we call it Indian New Year? Because Indian New Year means where everybody can contribute. There are too many New Year celebrated in India, as you know, southern India, other part of India. But why we call it Indian New Year is based on Vikramaditya calendar, and our endeavor in this Indian New Year to bring everyone on one platform. And where we are this year organizing this event, it is absolutely just to invite everyone from every part of the world.
And that is a very, very wonderful gesture that we're inviting everyone from every part to come in and take part in that. So looking at the function itself on the 10th of April, beginning from 2 p.m. till 8 p.m., what can people expect on the day? So just take us through the day.
Thanks for asking this question, because we are bringing exhibition. As some people have witnessed, they come in our last year we couldn't host because due to Corona we had to postpone. And in 2019, whatever people, those people who visited, they know we try to brought a mini India over here through show our culture and all the cultural heritage. And this year we try to bring our life cycles. We call it 4 ashramas, but we have divided into 4 life cycles. One is a birth, then is a family, marriage, family and death, and how they are important, how we prepare everything for that. And every ritual, like we put a we tulsi, plant a tulsi, other trees, why we put a gobar and everything is scientific. And I just want to tell people, just come and have enjoy, see the science behind every ritual, and please bring your family, your children. If they're not visited India, we try to create India for them over here. That's our endeavor, and that will be the showstopper. I think that exhibition should be visited by every Indian who's residing over here, because a lot of people coming from other states to enjoy this function. Already tickets are booked and they are already in touch with us.
Now that is wonderful that you're presenting all those things in that way, and of course looking at the event itself, people when they're going to functions and events, they always look at how much is going to cost us. So of course would like to know if there's any entry fees or not, or whether the event is a closed event or is it open to everyone, or the general public is welcome as well.
Question Meji, this is open event for everyone, no charges, free for everyone. Parking is very easy to accessible. It's underneath the King George Square, only $5 on Saturday, and there will be food stalls. There will be live music from 5:30 p.m. onwards. There are plenty to offer, a lot of live performances, especially for the kids. So we have tried to bring some kids performances. Everyone try to entangle try to rope up in a one time. They can get everything at one place.
And that is truly a full festival atmosphere, so full carnival atmosphere, but in a spiritual and manner, with cultural heritage, what customs and traditions have been passed on from generations, what have been kept, and why and how. The exhibition, as you mentioned, will have a special theme about it as well. So could we just talk a little bit about that?
Thank you very much for asking. The exhibition, like when we are young, we have a lot of rituals. We put all these things. They have scientific reasons, and then that's the first part we are covering. And then the second part, we come to the marriage. We put a henna, other things, and there's too many scientific reasons behind it. And people don't know. Just we touch the outer part of it, but every Indian thing is a scientific. And like then come to the family. Family is the backbone of our culture, and how we grow with the custom system. Like there is a lot of festival we husband and wife enjoy with the family, all the children, and then we put up trees. That even our houses, according to Vastu Shastra, they have a lot of science, because this Vastu Shastra is not like something we are superstition. It's absolutely pure science. I can't explain everything over here. And then the last most important thing, while completing all our family duties, most of the time our ancestors went to for the bhakti, for a prayer, go to the caves, go to the Himalayas, go to Gangas, because they try to prepare themselves for last part of their life, death. And death for them is an enjoyable thing. We all scared, but they enjoy it. They overcome. They do a lot of meditation. See, they have always, there's a science behind, because everyone prepare what's going to happen in their coming ashrama, and we call it 4 ashrama, but here we are calling it a 4 span of life. That's why I request everyone to come and enjoy all these things at under one roof.
And very well said once again, Sanjeev. As we know, that could be a very good topic for another day, when we can go into a little bit more discussion into that about the cycles. Death being something that that's going to happen, something that you are sure of. Why should you be afraid of that? You should always be afraid of things that you don't know about, but something that is there, which is guaranteed. You absolutely know that that's going to happen. Exactly. So right now, moving on, we're talking about the Bharatiya Warsh Utsav 2021, which is going to be held on King George Square on 10th of April from 2 p.m. till 8 p.m. That's so much to see, and if there, it's a totally free event, a family-friendly event, I would say, meaning that all, young and old alike, everyone, there'll be something for everyone. Youngsters can enjoy, and elderly people who are more like looking at some of the stalls and getting that higher spiritual level, so there'll be things for them as well, and absolutely free. A best way to spend your Saturday afternoon would be on 10th of April, is coming and joining in with the Bharatiya Warsh Utsav 2021. We'd like to see you all there. Sanjeev, is there anything else you'd like to add?
Yes, few things. Thank you very much for giving me more time. There are few things. One, people can enjoy free, not a free food. People can enjoy beautiful foods over there, and live music 5:30 p.m. onwards, and a lot of performances. And one thing I would like to especially mention that thank you very much Australian Indian Radio. Thank you very much Brisbane Indian Times. Thank you very much Umeshi, as you always being a part of this family and always supporting us through from last 10 years, and especially promoting this event. And thank you very much all your help and aspirations, and it's really inspiring for every every Divyajyoti devotees and every Indian. So you work for every Indian, and thank you very much. And in the last, I just remind you for a few things. Namaste, Jai Hind, Jai Maa Bharati.
Jai Baba.
See you all on
See you.
10th of April at King George Square with your family and friends.
Thank you.
Has been acquired in the community. We don't know how. We'll be getting genome sequencing results late today or early tomorrow that will assist us in working that through. But now the important thing is to respond. So everyone knows exactly what they need to do and has done that brilliantly over the last year. So we just need to put that back in place. We need to make sure that we are socially distancing, and where we can't, to wear a mask. And if we're in that vulnerable cohort, maybe stay at home for the next 3 days till we understand exactly what is happening here. So at this point, I'm just asking that everyone adhere to the requirements that are still in place. That is, in indoor areas, 1 person per 2 square metres. That's really important. Outdoor, we know, is very low risk, so let's go out and really enjoy the outdoors this weekend. I mean, you couldn't imagine a better weekend. It's just perfect. So everyone, please go outdoors, enjoy outdoors. We know that's very, very low risk. If you're going indoors, make sure you adhere to the 1 per 2 square metres and maintain some social distance from people that aren't in your normal household when you're going out to restaurants and venues and things like that. That hand hygiene's important. And most importantly of all, everyone, please stay home if you're sick, as this gentleman did who's tested positive. Once he became unwell, he stayed home. He's been fantastic. Come forward and get tested so we know what's going on, so we can contact trace as he did. So please, any signs of illness at all, just stay home and get yourself tested. We don't know where this virus is next going to pop up, but as I've always said, if we can find the first case in the cluster, not the 40th, we'll be able to get on top of it much, much, much more quickly. So this gentleman developed symptoms on Monday. He became, reasonably unwell. He then stayed home, so he had been out and about in his pre-symptomatic period, as you would expect for a young man, so I'm going to go through all those venues. He came forward yesterday and got tested at the Nunda Respiratory Clinic, and we got those results late last night. We've now absolutely confirmed them, so we've tested him twice on different platforms, and both times he's tested positive, so we know it is a confirmed positive case. We are doing other tests on him as we speak, so genome sequencing, for example, and other tests, so we'll get those results through today and into tomorrow, which will assist us. But in the meantime, we know he's absolutely a positive case. So the venues he's been through, I'm going to go through in detail. We will get more information. This is very, very early information, and I'm very grateful to this gentleman. So we moved him to Royal Brisbane and Women's Hospital last night so that we could work and get this information last night and early this morning. So back on the 20th of March at around 11 a.m, he was in the Carindale Shopping Centre and visited quite a few places through there, so that's a risk area. Then at 8 o'clock he went to Baskins and Robbins Ice Cream at Everton Park at 8 a.m. Then on the 21st, so that's last Sunday, he went to, at 9 o'clock, Fresh Food Market Stall at Gasworks at Newstead. And then at 12:20 he went to Mama's Italian Waterfront Restaurant at Redcliffe. So we'll of course be working with all of these places to get contact details for the hospitality places where there's a requirement to have that electronic contact detail information available. So I'm very grateful to those venues who will be working with us. Then on the 22nd, which is the day he started to get symptoms, he worked in Paddington. He works as a landscaper, so that's good because most of his work then has happened outside, so we'll work with him about that. Then he went through at Stafford at 12:30 that day to Guzman and Gomez as a drive-through, so there's probably minimal risk there. But then at 1 p.m. he went to Bunnings at Stafford. Then he stayed home all the next 2 days and went and got tested yesterday at the Nunda Respiratory Clinic at Sandgate Road in Nunda. So of course we'll have contact details for that, which we'll work through. And he also went to the Audi at Stafford for around 10 minutes that day. So we'll get all of this information out with specific time frames, and anyone who's been to any of these venues during specific time frames, I want you to come forward and get tested whether or not you've got symptoms, and to remain in isolation till you get a negative result. Everyone else who lives anywhere in Brisbane or Moreton Bay, it's really important. Any symptoms at all, please come forward to one of our many fever clinics and get yourself tested. That is critical. And anyone who lives in Brisbane who becomes unwell in the next 14 days, if you're going out and about, your normal business, you might be visiting in other parts of the state, it's important that you come forward wherever you are in Queensland and get yourself tested. That's really important. That it is testing that will help us get out of this particular incident, as we have with other incidents as we move forward. Then of course we are protecting our most vulnerable, although a lot of them have already had their first dose of the vaccine and even getting their second dose. Despite that, we will be putting a requirement on aged care, disability care, our corrective services, our prisons and our hospitals in the Brisbane and the Moreton Bay area to limit visitors and to use masks, except for, of course, end-of-life visits. So we'll be protecting our most vulnerable, and that will be in place from midday today. Everyone else, I'm asking, go about your normal business, but be a bit more cautious. Stay home if you're sick, and if you're somewhere where you can't socially distance, for instance in supermarkets, on public transport, going to big games at stadiums and so forth, put a mask on. Once you're seated and in a seat that we know where you are, you've got a ticket and a seat, you don't need to wear a mask at that point. But of course, if you feel safer or happy to, then a mask is always a very good idea. Thank you.
Do you have any suspicions as to where he might have caught it?
It's too early. I need the genome sequence first before I can work that through. But he has not been overseas in his period that he would have acquired this.
Dr. Young, does he have flatmates that close?
Yes, and they're all in immediately, of course, in quarantine.
Do you know roughly how many close contacts have been contacted so far?
We're very early. I found out about this, 10 o'clock last night, so they've done an awful lot of work already, and all of that work, as you've pointed out, is progressing rapidly.
Are you expecting an increase in locations over the next couple of hours? Because
I am. I think for him to have remembered this information is just brilliant, and he'll remember more, and we'll be working with him. He's been extremely helpful, very helpful, but I would imagine that we'll see other venues, and we'll put those out there as soon as we find out about them.
surely it's quite concerning though that there's absolutely no link and he's been out in the community infections for a week.
Of course it's concerning. That's why we're here this morning before having all of this information, letting the community know. The most important thing is that everyone, we're not out of this pandemic. It's so important. If you get any symptoms at all, come forward and get tested like this man has done. That is really important. We did just have an outbreak within the last 2 weeks in South Brisbane, so there's a chance it's linked to that one. We won't know until we get the genome sequence result.
How many people could have been exposed to him? Like hundreds, thousands?
Yeah, he's a young man who's been out and about in his normal life, so yes, I'm sure he's had contact with a lot of people. That's why it's really important for everyone, if you have any symptoms, to come forward and get tested. And I don't know where he's got it from, and that person he's got it from could also be out and about in our community spreading the infection.
You mentioned he was in hospital. How severe are his symptoms?
They're not severe. that is just to make it easier for us to talk to him, to get all this information, to remove him from his housemates and to just manage it. So I'm very grateful that he's come into hospital and we can work with him there.
You've urged vulnerable groups to stay home for the next 3 days. Can you just recap who falls under that category?
People will know themselves if they're vulnerable. So if anyone feels that they're in a vulnerable category, it's not changed. It's people who are older, it's people with underlying health conditions, then they just might like to think about what they're doing this weekend. If they're going in a family group, then of course that's not a risk. If they're going outside, it's not a risk. But it mightn't be the time for them to go to a very crowded venue.
Can Queenslanders expect to see more restrictions over the next 24 hours?
I definitely hope not, because I think Queenslanders know how to respond to these things and do it really, really well, and we've seen that for the last outbreaks we've had. Queenslanders know what to do, they do it well. So I would hope we don't need to have more restrictions, but it just depends what unfolds over the next 24, 48 hours. But we need to get used to living with this virus. We're getting more and more people vaccinated. We've got great stats there. So as we get more people vaccinated, the requirement to put restrictions in will diminish. We're just at the cusp at the moment between having to put in restrictions and having people vaccinated.
As you mentioned, some people have already had their first round of vaccinations. Should they feel some sense of ease that they've got a level of cover there?
Yes, of course they should. But we really need people to get the second dose and then to have a week after that to be fully protected. So they just have to be a little bit careful still, but one dose gives you significant protection, 2 gives you fantastic protection, and then after that it takes about another week to get that full protection.
You mentioned he got tested, then went to Aldi. Did he do the wrong thing and not isolate?
He only went there very, very briefly, and you can just imagine what he went there very briefly. He really and truly was fantastic. He stayed home those 2 days.
Usually, though, you would recommend against that, though, wouldn't you, after you've been tested?
Well, no, he went before he got tested.
Oh.
I'm sorry, I made that unclear. No, he went home after he got tested. Absolutely. He just popped in on the way through, which you can imagine. He spent 10 minutes there.
How many cases in Queensland at the moment have the PNG variant? Do you know?
I think it's, of our active cases, it's around about 2/3 have got that PNG variant. Now, the PNG variant is a different variant, but it's not a variant of concern, if I can make that clear. It's just, it has developed and it's restricted to PNG in Australia because it's developed in our part of the world. But it's not one of those variants of concern that have been notified internationally.
Do we know if this man have the UK variant?
No, I said later today. Later, we need genome sequencing takes 24 hours to do, so we should get that hopefully later today or tomorrow morning.
I know you've sort of answered this, but what's the hypothesis for how he possibly got it? I think a lot of people would be incredibly confused. He just caught it in the community? Or
Yes.
Yes,
this is why we need those restrictions to remain in place. The 1 person per 2 metres, indoors, getting all those contact details, people maintaining their distance, washing their hands, staying home when they're sick. That's the most important one. We are not out of this pandemic until everyone's had the chance to be vaccinated. We really and truly are going to see this continue to happen.
Given that, then, is it really less concerned about this man and more concerned about the person who's still out there and potentially still infecting people?
Possibly, although that person might no longer be infectious. It's a bit hard to hypothesise on something you don't know anything about.
Have businesses been keeping up with the electronic registering of when people arrive?
That's what we'll find out today as we go to these businesses and ask for their details. But we saw in the last one with that doctor who was infected that the businesses involved there had very, very good contact details. for their people.
The Premier touched on it. Do you think people are getting a bit complacent with shaking hands and not socially distancing? And do you think, should we ban handshakes, or how strong of a measure do you think we need to put back?
This is so hard for people. It's so long since we've had any outbreaks that I can fully understand. People want to get back to their normal lives. We all want to do that. And human touch is so important to humans. What I'm just saying is, please, while we go through this and until everyone's had the chance to be vaccinated, we need to try and maintain those boundaries between people that you don't know. It's important to touch the people in your own household. We need touch. But if we could, when we're out and about, try not to touch other people. That's important. It just is that other level of protection.
Has this man gone into the ward 6A at the Royal Brisbane?
He's been admitted to the Royal Brisbane and Women's Hospital last night, yes.
Into that?
I don't know. I think he's gone into Wattle Bray, their infectious diseases ward.
Was the decision making behind?
So, ladies and gentlemen, there you are, one new locally acquired case in Brisbane. So, and that's why we brought to you that breaking news without any introduction, because I just wanted to join in the live. So, Queensland had recorded a new locally acquired case of COVID-19, and Premier Anastasia Palaszczuk has confirmed a new infection. A 26-year-old man is from Stafford in Brisbane, and he has tested positive to the result, and that positive result was returned yesterday. However, the man has been infectious and he has been in the community since last Friday. Ms. Palaszczuk said there is no need for alarm, but there are a number of venues of concerns, including Bunnings, fresh food market stalls and other shopping venues, as was mentioned just before by our, and he's the Premier again.
We've seen before we've come out of this, so as long as people go out and get tested, I think we'll come through it okay. But the next, like we said, it's the next, 3 days will be very critical to see if there's any further community spread. And if people have been to those venues, please come forward and get tested. That's absolutely critical.
If he does have the UK strain, does that change things for you?
No, the advice from Dr. Young is that we've been able to manage this very well with the PA doctor, so we're actually following everything we've done there as well. So, but like I said, if you're in those crowded areas, put your masks on, and let's just see how we go over the next 3 days.
I mean, you may be able to answer this. The Ward 6A, the Royal Brisbane, what was the decision making in setting up a hotel?
That's a matter for health. Yeah. Okay.
Can I just comment on that? We're not setting up hotel quarantine for positive patients. I don't know where that term's come from. We have been looking at alternative ways of managing patients who are COVID positive but otherwise are well, and not needing to be in ICU or dedicated sort of health treatment, but still having them in the hospital system. So we're looking at whether we can bring more of those patients to a single site as opposed to spread over different hospitals. So we've been investigating different options of taking pressure off the health system but still keeping them in the hospital. So there's no hotel quarantine for positive patients. That's what other jurisdictions have done. We don't do that. Everyone who's positive gets moved into the hospital system, but it's just how we manage them in the hospital system so that we can make sure that we're looking after them, but where they're otherwise quite well, they're there just to assure that we don't get broader community transmission. We're looking at how to best manage them in the health system. Can I just also say, as the Premier said, we've had fantastic results with our vaccinations, and I want to thank all of our staff working in our vaccinations, from our administrative and our booking staff through to our nurses and our doctors. We've had 53,893 vaccinations in Queensland now. That's just the state, so it's not including what the Commonwealth are doing in aged care and now the GPs. We had set ourselves a target of getting to 20,000 a week by mid-April. Well, we're going to achieve that by the end of today. So we're really thrilled that the staff have been able to hit that 20,000 target by the end of today, and I just want to thank them for that. Can I also just clarify, when we talk about Moreton Bay, we're talking about Moreton Bay Regional Council, so not Moreton Bay in the broader sense as we know it. on the north and south side. It's Brisbane City Council and Moreton Bay Regional Council when it comes to hospitals, aged care facilities, disability facilities, and of course correctional services. And we do remind people social hygiene, making sure they're social distancing. If they can't social distance, wear that mask. Checking in, and we did see from the PA positive case that of all those venues that were contact traced, I think there was only 6 people who hadn't checked in, which is a fantastic result. So we remind everyone that you need to be checking in. We remind venues there is an obligation on you to make sure that every customer that is walking in the door and is seated, that they're checking in, but also as customers we have the responsibility to make sure that we're doing that as well. We will also be ensuring that we have adequate testing clinic capacity for the next few days. So across Brisbane City Council, Moreton Bay Regional Council, we will make sure that we can, if need be, expand our testing capacity quickly. The fever clinics in those areas will be open over the weekend, so I remind people that they can go out and get tested if they're not feeling well over the weekend. We do remind people that when these incidents happen, there is often lines. Please be patient, please be respectful to the nursing staff and the staff managing the fever clinics, but we will be doing our best to get people through those testing clinics as quickly as possible. But if you have any symptoms, stay home, get tested and isolate yourself until you have those results.
Back on those setting up new facilities for potential quarantine, is that in response to the Papua New Guinea soaring numbers and 90%?
Look, it's in response to increased numbers overall. So we know, we've been saying this for some time, we are seeing increased numbers of people coming from overseas who are positive. We're getting positive cases every single week. We have definitely seen an increase as a consequence of Papua New Guinea. Yeah, that is concerning, and of course the Commonwealth and the Premier's been talking with the Commonwealth about that. But we do need to be mindful. We are getting to what is our highest numbers we've ever had in the hospital system since COVID started. So 69 positive cases today. So we just want to make sure we're keeping the community safe, we're managing our positive COVID patients, and at the same time we're working with the hospital system to ease some of those pressures that we're seeing with the growing number of positive cases.
We've still got international.
So, and that's Minister Yvette data. Of course, 69 active cases and 1 new locally acquired case which has come forward, and it's being managed well by the authorities. But the message is loud and clear that we do need to do our bit, and we need to remain safe.
Basically every day now we're seeing positive cases in hotel quarantine, and over the last couple of weeks the large majority of them are coming from Papua New Guinea. Even though the reduction has happened, I do think that this is a really serious issue, and I'll be having further conversations with the Commonwealth Government about that.
Are you frustrated that we're supporting your proposal to have a facility
the departments have been speaking, federal and state departments have been speaking about that, but as I said very clearly, we need an answer from the Commonwealth. Are they interested, yes or no? It's a very simple question. Okay, thank you. Thanks.
Thank you very much, Premier, for that update. And of course, it is very, very important, as I was saying before, that we do our bit. Our bit meaning, observe those restrictions. If you unsure, wear that mask. If you're out in the community, keep that social distancing. Of course, the indoor and outdoor rules are slightly different. Outdoor is what's recommended, and as the Premier said, it's a beautiful weekend and in beautiful Queensland. Go out and be out and about, but of course, always take care. And if you have any symptoms at all, please do go get checked. And it is, it is by checking that all these things will happen. And as the Premier said, they are thankful to this gentleman for coming out and reporting the incident. If it's not reported, it will not be known. So once again, ladies and gentlemen, thank you very much for joining in. And now we'll just take a quick look at all the functions and events that are taking place. But first of all, I'd like to talk to you about the upcoming Music Junction, Live Junction, and this time we are pleased to announce that we will be having live musicians and live singing all the way from Kolkata. So joining in from Kolkata Arnab and Annie with live musicians, and so will be hosted by Praja right here on this channel on Sunday from 6 p.m. So, go celebrate Holi during the day. In the afternoon, sit back, relax, and enjoy this beautiful, beautiful event, which will be, live streamed right from here. Well, right now, let's take a look at some of the functions and events. So, ladies and gentlemen, that's all we have time for today, and this has been an extended session because we had that breaking news come in of that new locally acquired case, which I thought was very important for our community to know about. And once again, thank you so much for joining in. It's always so good to see you. And with this, promise that we will be back together tomorrow morning at 10 a.m. for the weekend edition of this live show. Until then, it's goodbye from me. Remain safe.